The hair. Once you see it once, don't forget it.
Good evening, everyone, and welcome to our regular city council meeting. Clerk, would you please call the roll?
Mayor Hartke,
Here.
Vice Mayor Stewart,
Here.
Councilmember Harris,
Here.
Councilmember Lopez,
Here.
Councilmember Rowe,
Here.
Councilmember Ellis,
Here.
Councilmember Orlando.
Here.
We have a quorum.
All right, our invocation will be led by Pastor Victor Hardy of the Congregational Church of the Valley. Our Pledge of Allegiance by Councilmember Lopez.
Let us pray. Not another second or another minute, no, not an hour or another day, but at this moment, with our arms outstretched, we need you to make a way as you have done so many times before, through a window or an open door. We stretch our hands to thee. Come and rescue us. We need you right away. We need you now. We need you now. We need you now. We need you now. Not another second or another minute. No, no, no. Not an hour or another day, but at this moment, with our arms outstretched, we need you right away. And all those in favor say amen. Amen.
I almost sat down.
I was waiting for more. Please join me in reciting our pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Pastor. Thank you, Council Member. Council, we have a proclamation to read tonight on Drowning Awareness or Impact Awareness Month. And, I didn't figure out who to invite up there with me. So the first one to the front with me. There you go. Sorry, Councilmember Orlando, I should have gone out that way. Thank you. And is there anyone coming up to receive this? Oh, very good. Thank you. All right, let me read this proclamation and turn this over for comments, and then we will take a picture. Proclamation, whereas the City of Chandler is committed to improving the safety and security of all those living and visiting our community and dedicated to creating safe swimming facilities, aquatic programs that provide healthy places to recreate and learn lifelong skills that contribute to the quality of life for our residents. And whereas 10 people drown every day in the United States, where drowning remains the top cause of injury and death for children and teens in Arizona, which is 100% preventable. And whereas the Chandler Aquatics, Chandler Fire Department, and Chandler Police understand the essential role that water safety education plays in preventing drowning and recreational water-related injuries. And whereas during the month of August, the City of Chandler will be engaged with community organizations and residents throughout Arizona to help prevent drownings in Arizona. Now, therefore, I, Kevin Hartke, Mayor of the City of Chandler, Arizona, hereby recognize the month of August 2021 as Drowning Impact Awareness Month. And with that, would you like to make some comments?
Thank you, Mayor. Appreciate it. So drowning is, like we said in the proclamation, the #1 cause of death for children under the age of 5. So we are super thankful that the city is supporting us in our efforts to combat drowning. Drowning does not know any economic status. It doesn't know race or anything like that. It can happen to anyone. So it's really important that the work that we're doing alongside with fire and police and getting out into the community and stopping drownings happening in our community to lessen that impact on families, but also the community. So thank you.
Well said.
I guess I'm going to say a few words. Drowning being the #1 cause of death for teens and children in the state of Arizona, that is obviously a big public safety issue. And public safety is our primary focus here at the police department. So even though this is a new partnership between us and the fire department and aquatics, we are happy to leverage our considerable resources towards fighting this scourge. And I'd like to thank you, Mayor and City Council, for endorsing our effort.
Thank you. Thank you. Council, we have a consent agenda before us that we looked at on Monday. Unless there's any further questions, a motion would be in order.
Mayor.
Vice Mayor.
Mayor, I'd like to make a motion to approve the consent agenda for Thursday, August 12th, 2021.
All right, we have a motion. Is there a second?
Second.
I heard Councilmember Rowe first, so we'll go motion and second. Council, I know,
Mayor,
I think Councilmember Orlando.
yeah, Mayor, I have a conflict of interest, item 17. I have a family member that lives in the area. And I also want to do a shout out to Mr. Bill Woodruff, who's here. Bill, it's good to see you back on your feet again, my friend.
All right, any additional comments or statements? If not, council, please vote.
Motion carries unanimously with exception of item 17, Councilmember Orlando declaring a conflict of interest, and it passes by majority.
Thank you, City Clerk. All right. To all of you who are still here, we've got a couple briefings and you have options. Next on our agenda, we do have 2 briefings brought forth by Councilmember Harris. The first is an update on 19 as requested by Councilmember Harris. Councilmember.
Thank you, Mayor. I wanted to bring forth Chief Duigans to talk to us about where we are with COVID-19 and how we're doing as a city. I think it's important that we stay connected to what's going on. We've heard of the Delta variant, and we're hearing various different strands as it metamorphoses. And I really want to bring forth, are we still practicing? What are the new protocols, if there is any? And how are we doing in terms of vaccinations from maybe a city or a state perspective, and keeping all things, within our region? Are there any additional best practices that you would recommend to the body? Thank you.
Thank you, Mayor, members of the council. Through the mayor, Councilmember Harris, I did prepare a very brief presentation, and we will discuss what the current case count is here in the city and across the region, as well as the vaccine percentages, where we are as a community. And including that, I did want to speak briefly on the hospital situation and what is going on with their status, and then the CDC recommendations. So before I start, there are different data points in here. And one thing, and I know I've heard from many of you, it can be very confusing trying to get accurate data regarding the COVID-19 pandemic. And I can tell you that, we really focus on three main data sources, which is the CDC, the Arizona Department of Health Services, and the Maricopa Department of Public Health. And so everything that you see tonight was taken from one of those sites, and they were all updated this morning at 9:30 a.m. So starting out, we want to look at our infection rate. And what you see here is a slide that looks at the percentage of a population in each area here that have received a positive test at some point. And so when we look at the United States, in general, the population, 11.2% of its population has been positive for COVID-19. Arizona is at 13.2%, and I believe Arizona ranks 12th in the nation right now. Maricopa County is at 12.9%, and the city of Chandler is at 13%. So when we look at the city of Chandler, we are very comparable to where the county is and where the state of Arizona is, and we're just a little bit above the United States.
Chief, a question. So related to that, that's over positive cases to date, correct? So it's not a today statement, although it's accumulation up to today.
Mayor, that's correct. This is from the first case that was seen in the United States, Chandler, all of these areas. So this is cumulative since the pandemic began.
So it took in the huge spike that we had, or the two crests earlier.
Absolutely.
Very good. Thank you.
Mayor,
Councilmember Lopez.
if you're able to answer, does this also include antibody testing in a case count, or is it only viral positives?
Mayor, Councilmember, this is just positive PCR tests.
Okay.
So this is not antibody testing.
Okay, thank you.
So our next slide, this slide is especially the picture on the right shows the current epi curve. And this was pulled off of the site this morning. And you can see that we have three distinct waves. The first wave, which occurred in June of 2020. The second one was January 2021. And then the current wave that we're in right now, which is really spearheaded by the Delta variant, is occurring in August. What I have here is this is just a point in time. And so when we look at that first spike, that first wave, the highest case total in one day for the state of Arizona was 5,510. When we look at the second wave, which was the much larger wave, on January 4th, the highest case total was 12,393. And now we look at the current wave, or the third wave that we're in right now, and the highest case total was actually on August 2nd, and that's 3,125. Now, I know today's numbers, I believe, are at 2,900, and we have not seen a 3,000 number yet. What happens is, as they put these data points in there and they update these charts, they'll backfill. So those numbers will change throughout time. And we did look this morning, and they did update August 2nd, so it is at the 3,100 point. We do expect that to the current, where we are today, to change. But as far as where we're going, just nobody knows. It's hard to project. I spent a lot of time today. I had a great meeting with Dr. Rebecca Sonnenschein, who's the director of Maricopa Public Health. And as you guys know, we've talked about this many times, there's a lot of projections out there, but we just don't know if this is now going to flatten out and then we're going to go back down. And so we're taking it one day at a time. Okay, so the vaccines, and the vaccines are so important, and we've been talking about vaccines for a long time now. And so we wanted to show a slide that looks at our vaccination rate. Again, when we're looking at vaccine rates across the board, the way that it's reported is different depending on the site. Some people report it for total population, in other words, from 1 day old till 110. Some will say 12 and above because that's what's considered the eligible population, because Pfizer will allow you to go to 12. And a lot of sites, and probably the most popular ones, will do adults. And so they'll say 18 and above. It's very inconsistent across the board. And so what I wanted to do was to show you comparables that were the same. And so we went with the percentage of the population with at least one dose. That means that they may have just started their vaccine process. They have the first dose and they're waiting for the 21 days for the second one. We also based these percentages off the total population. We didn't go off of 12-year-olds or 18 and above. And so when we look at the United States, we're at 59.1%. Arizona's at 53.8%. The county is at 49.7%, and the city of Chandler is at 54.2%. I can tell you in researching the United States and Arizona and Maricopa County, they all give very specific to 18 and older. And in each case, you can add anywhere from 10 to 11 percentage points. And that will be what your adult population is as far as their vaccination rate. When we get into the zip code data on AZDHS or Maricopa Public Health, they just don't differentiate between age. And so that's why we wanted to make sure it was consistent. However, when I look at this, it does show me that the city of Chandler right now is outpacing the county as far as our overall rate. It is consistent with Arizona, and it's a little bit behind the United States. One great thing about the data that we get from the county is it breaks it down into the zip codes. And so we know by zip codes, we know the population, we know everything from the gender of the people that are receiving the vaccine, the ethnic background. And so we have a lot of useful data if moving forward, the county wanted to target any type of marketing for the vaccine. They have captured the data that they need to do that. And we certainly in Chandler, we see a difference between North Chandler and South Chandler as far as the percentage of people vaccinated within that population. Okay, so outside of vaccines, the hospital infrastructure has always been important from day one. That's one area that we needed to protect. And so what this slide does is it gives us a comparison of where we are today versus the previous two waves. So you can see in July of 2020, that was the first wave. Again, January 2020 was the second one, and the current one we're in. When we look at COVID-19 inpatient count, July of 2020 was at right over 3,500. And this is on one single day. So this is the highest point in one single day. In January of 2021, the highest point was 5,082. And in August of 2021, right now, and I believe it was yesterday, it was 1,527. When you go through all of these, the ICU count, the ER count, the ventilator count, it's all the same in that the second spike obviously had the higher number of patients, followed by the first spike, and then what we're going into now. It basically works out to the current wave that we're in is about 1/3 of what the first wave was and 1/4 of what the second wave is. Now, capacity is extremely important, and I know I've had questions before about hospital capacity. Right now, hospital capacity is about the same as you saw at the top of the second wave and the top of the first wave. But I think it's important to remember that in both cases in those waves, there were mechanisms in place through executive orders that they stopped elective surgeries, that they created additional capacity in the hospitals, and they're not doing that right now. And what that tells me, and I did have a great conversation this week with the hospitals, that those trigger points are still in place. And if for some reason we saw an influx where capacity was an issue, they could very easily go back to where they were and create that capacity. And so I feel very comfortable with where they are. I will say with the hospital, and you may have heard this, probably the biggest issue right now is staffing. And we know that staffing across the country, there's a nurse shortage. Every state is trying to steal the other state's nurses to bring them in to treat these patients. And so there's a lot of concern moving forward as far as will they have the proper staffing if we do see an influx. And they are seeing more COVID patients, but it's a manageable number right now. The other issue that's looming is the mandated vaccines. And as you put the dates down for mandating vaccines in the hospital, there's a fear that some of these nurses, some of these physicians, the people that treat these patients will not get that vaccine and potentially will not be employed, which will really just exacerbate the problem with the staffing issues anyways. And so again, I know that the hospitals have stood up their incident management system. They are meeting frequently to look at and address these problems. And right now, based off of my conversations this week, I'm very confident where we are overall as a system with the hospitals. Okay, so CDC recommendations. These recommendations, they change, it seems like, by the week. What I wanted to do was go into their site and really look at 3 or 4 recommendations that I think were very applicable and that most of us already know, but I thought it was a good opportunity for us to talk about one more time. Obviously, the first recommendation is vaccination. There are 3 vaccinations available right now, the Moderna, the Johnson & Johnson, and the Pfizer. As I said earlier, the Pfizer goes down to 12 years, but the Moderna and Johnson & Johnson, it's 18 years and older. The vaccines so far have proved to work well. That was one of the big talking points today at the meeting with public health, is they have studies that show that all 3 of them, they provide 80% protection against being infected with the virus. They provide 85% protection from getting the virus and being symptomatic. And they provide 95% protection against severe illness, hospitalization, or death. And this is based on numbers that they're seeing, not only here in the United States, but some of the other countries that are already experiencing. And this is all compared to the Delta variant. And so they are extremely effective against the Delta variant. Masks are still something that the CDC are recommending. There has been a change. They are asking that all individuals, vaccinated or not vaccinated, use masks when they're indoors in public facilities in areas of substantial or high transmission. And so the CDC really breaks down transmission into 4 areas: low, moderate, substantial, and high. They get those areas based on your case count per 100,000. The highest area is obviously the high count, and that is anything over 100 cases per 100,000. This morning, the county reported they were at 280 cases per 100,000. So Maricopa County in general is right now in a high transmission area. Social distancing. Social distancing, it still works. The rule out there is you want to put 6 feet of distance between yourself and another individual, and you want to reduce your exposure or contact. We say anything that is within 6 feet, more than 15 minutes cumulative, is considered a close contact, and those individuals would fall into the protocols of close contact where they have to wear a mask, they have to get tested. So if you can distance yourself, if you can really limit your exposure, you should really help to stop or prevent getting the virus. The last one is hygiene. Again, hygiene is always important. Wash your hands for more than 20 seconds. If you're in a workspace, make sure you're washing those areas as well. Okay, but the last slide I have here, and this is just for any individuals out there that are watching this meeting that I changed their mind for some reason. I'm not sure that worked, but they want a vaccine. If you go to vaccines.gov/search, and I did this, and I punched in our zip codes. The first screen you're going to see is going to ask for your zip code. it will give you a multitude of opportunities to get a vaccine. It'll tell you whether it's Pfizer, Johnson and Johnson, and honestly, within 3 miles of any direction, it looks like there's a clinic, there's a drugstore, there's a grocery store, there's somebody who's offering the vaccine. And so, if somebody is struggling to find one, this is really the clearinghouse for all of the areas that are providing. You can go here within 1 minute, you'll have 4 or 5 options that you can go to. Okay, with that, that's the end of the presentation. I'd be happy to answer any questions.
Thank you, Chief. Council, any questions? Councilmember Harris.
Yeah, thanks, Chief, for the presentation. Just a little bit. You talked about the safety protocols. You talked about masks. I know a lot of people are, have reached out about masks. Is the priority to get vaccinated based on your data that is the priority getting vaccinated and then using the mask as a protocol to reduce the spread?
Through the mayor, Councilmember Harris, absolutely. The number one priority is to get vaccinated. That is the best thing that you can do to protect yourself. As I said earlier, these vaccines work very well against not only COVID-19, but the different variants that you see. And so that would be the first thing that you need to do. As far as the mask goes, we follow CDC protocols, and we really don't get into the science. But they have said that they advise to wear masks right now when you're indoors in high areas to help prevent the spread. And so it's not as high up as the vaccine, but it is the second one that they're recommending.
And my last question to you, Chief, and thanks for your presentation. When a lot of people watch social media, get the Facebook news, the Twitter news, or more so Facebook, it just spreads a lot of untruth because people make up things every day. But part of the concern that people who retweets and watches things on Facebook, they say getting vaccinated will add another arm, another leg, another eyeball, another something to you, or anything to you. So I wanted to just, for the record, in the studies and in your calls and your phone calls, have you learned of some massive breakout of defects from being vaccinated?
Mayor, Councilmember Harris, there are a lot of physicians on Facebook that offer advice, but we really try to stick to the professionals. And this was a question again that was explored this morning, and it was really about protecting firefighters and trying to overcome their fears of getting the vaccine. There was a virologist there from the state who said that there are adverse reactions, and I know many people probably in this room got the vaccine and may have had a slight fever or felt run down for 6 to 12 hours. Occasionally, and it is extremely rare, there are some other issues that could happen. But when you balance that out versus getting the virus, it's really, the risk reward there is what you have to look at. And so I have not seen a study that shows, some consistent disease process or issue from the vaccines. I have heard of some things, but the numbers were just low, so low. In fact, it's probably equivalent to what you would see from aspirin, Tylenol, any of the other medications that you take, where you always have, a chance that you could have some type of reaction.
So your final recommendation is that people should get vaccinated?
Mayor, council member, absolutely. Vaccinations, this is my opinion, but it's based off of the conversations with the professionals, not only within the hospital system, but within the state public health DHS, is that the number one priority is to get vaccinated.
Councilmember Ellis.
Thank you, Mayor. You mentioned about nurses, the shortage, whether it's first responders, doctors, and things. The hospitals that you have spoken with, or in the trend that you're seeing in Arizona, is that the way that we're going right now with mandated, or is it still going to be up to the person to be vaccinated?
Mayor, council member, right now the state, there are hospital systems that are mandating the vaccines. I believe that Valley Wise just did the other day, Banner, and I'm pretty sure Dignity did today, and they're mandating it for November 1st. And so, for sure, there are mandates coming, and what's going to happen when that date gets here, nobody knows.
Thank you.
Councilmember Orlando.
Thank you, Mayor. Chief, I was reading an article the other day, and if they brought this up today at the county level, I got confirmation, is the emergency use. I think there's legitimate concern by folks out there. I know people that are just saying to me, Matt, I would get it, but I'm just afraid of this emergency use. And I know the federal FDA is looking at trying to get this approval as soon as obviously it's feasible. The number I saw, and I don't know if the county brought this up today, was like 25 to 30% of the people are actually waiting for this to have final approval. And I know you guys talked about that at all today.
Through the mayor, Councilmember Orlando, this subject did come up as well, as far as when FDA approval would occur. And there was some speculation that it could occur within the next few weeks.
Okay.
And that's just for one of the manufacturers. The other two have not applied yet. As far as a specific number of percentage of people that are waiting, I have not seen anything. Obviously, I've heard that people saying that they're concerned about that, and then once the FDA does approve, they would get the vaccine. But as far as an exact number, I have no idea.
I didn't think so. Like I said, these are just polls and things like that. But the other question I have for you, you said Chandler is at 54.2%. Do you have a breakout by zip codes? What areas are doing stronger and what areas are probably need more education?
Councilmember Orlando, I do. I put a couple extra slides just in case, because I cannot memorize all of this. But if you had this question. So this was taken from this morning. This is actually the Maricopa Department of Public Health site. And so what we did was we broke it down by the zip code. We showed the population in the zip code, the actual percentage positive within that zip code. And so that's everyone within that population. And then what the vaccination rate is. So you can see that our highest vaccination rate is 85249. They have a percent positivity of 13%. And then 85225, which is also our largest populated zip code, it's got a 15% positive rate, and it has a vaccination rate at 47%. So that would obviously be the target area for public health, to whether it's marketing or whatever engagement that they need to do to see if we could increase the total percentage of people vaccinated.
Yeah. Okay. Well, hopefully the county comes up with some ideas on how we could work with them if possible. Obviously, you guys have been doing a lot of work over there on giving vaccinations. Certainly appreciate that. I guess the final question I have, Mayor, is Chief, does the correlation of those that are vaccinated and these different zip codes, do they match the number of cases that we're seeing? In other words, is it a parallel? If you're getting vaccination, you should see a lower COVID positive rate, or are we seeing something different?
Councilmember Orlando, so we tracked data, the specific zip code data every day for, it seems like, almost a year. And we had stopped within the last 4 months. We just started looking at it again. 85225 will always have the most cases, but it's also double the size of some of the other zip codes. So we would have to go retro, and I think the fair thing to do would be to do it now while this Delta variant is out there, to really determine, what is the percentage right now that we're seeing versus how many are vaccinated. So I don't have that exact number, but that's something that, moving forward, we could put something together.
Yeah, that's fine. I was just intuitively thinking that you would have a relationship there, which we're seeing nationwide and in some states as well. Okay. Thank you, Mayor. Thanks for bringing us forward, Councilmember Harris. Appreciate it.
Councilmember Ellis.
Thank you, Mayor. Chief, we're talking about the corridor where we had the most of our elderly population living in, which is also inpatient. and those that are in nursing homes and things like that. How are we doing on that as far as that population being on the type tier? I know that when we were giving vaccination, we prioritized them first. And then now, where are we with that population, specifically in Chandler? Because we really got hit really hard in those corridors.
Through the mayor, Councilmember Ellis, we had set up a task force with all of our nursing homes to bring them together, to share resources, to try to understand best practices during the first wave. During the second wave, we had contact once a week just to see how everyone was doing, and they were doing much better. We reestablished that contact on Monday of this week. We called our 6 biggest care homes. We wanted to know where they were at with positive cases, where they were at with PPE, vaccines, and really all 6 of them are doing outstanding. Right now, they have their policies, their internal policies in place. They've gone through this once, so they understand how to navigate through this. And additionally, I think they said 90% of their residents are vaccinated. A good percentage of their workforce is vaccinated, and the ones that are not vaccinated are tested twice per week. They do have 30 days of PPE supply, but they have a good line to get more PPE. They can only just get it 1 month at a time. So right now, they had no needs from us.
Okay,
We
that's good.
did ask that we check in once a week again just to see how everyone was doing, and they were content with that.
Really appreciate your leadership on that, because I know the last time I met with you, that was one of my main concerns, and you knew I was not happy with that.
Yes, I did.
And so I'm glad that you went back and make sure that this time around we are well equipped. Appreciate you.
No problem.
All right. Thank you, Chief.
Thank you.
Our second briefing was also requested by Councilmember Harris on eviction prevention and utility assistance at Leopold. Councilmember Harris.
Yes, thanks. Thank you, Mayor. I thought this was an important topic because if we're going to talk about COVID and what the implications and the impacts that it's having on our community, we definitely know that COVID is impacting us financially across the board, everyone. We want to make sure that those that are in our marginalized community is still being protected, still have resources to receive dollars from the city of Chandler, and just to continue to keep us updated on where we are with our CARES Act funding, and then also to let the public know our partners, who they are, how they can reach out to them, and if there's any additional information we can provide at this time would be great. But if there's something that they need to go further, have conversations with our partners that we've designated at this time, they can do that too, and how they do it. So, Leah?
Leah.
Thank you, Mayor. Thank you, members of the council. Thank you, Councilmember Harris, for inviting me this evening. Going to talk to you a little bit about our emergency rental assistance program, where we are today with this. We'll start with the timeline. To remind everyone, the first eviction moratorium began in March of 2020. As you know, it has been extended a number of times. There was a little bit of a lapse between July 31st and August 3rd where the moratorium had ceased for a few days. It is back on until October 3rd. The difference with this moratorium, though, is it's tied to counties that are at the substantial or high level, as the chief just spoke about. And so and right now, all of Arizona is considered in the high level. If you also look along with this are the funds that have come forward to the city. And we started with our CARES Act. We moved into our ERA 1, which I'm going to give you more detail on in a moment. And then the third set of funds that we have today that we have not brought to you for allocation yet, but we anticipate doing that in September, is our ERA 2 money. So this right here talks about the ERA 1. And we have served through Ascent, who is our partner. That's our CAP office. Ascent has been the CAP office for many, many years now. It's not just with these dollars, but it's also recognized as by the county as the official CAP office for Chandler. The county too gives funding to Ascend for CAP services. And through the CAP office, there's 432 households that have been served. You can see our total expenditures at $3.2 million. We wanted to break out the utility assistance for you, and so you'll see there the 358 in utilities. And of those 358, there are 70 households in water. Now that may seem like a low number, and the reason for that is for most of the households that rent, the water is included in their rent. The ERA 1 dollars are specifically for rental, they're not for homeowners. CAP office does have additional funds that they've been able to use for homeowners. And there are some funds at the state level that we hope might trickle down that could also be used for homeowners. Our Chandler Cares team, we assembled the Chandler Cares team in August of 2020. And you can see our 3 Cares team members here, Cece, Lilia, and Dylan. Dylan happens to be here with us this evening. They do an amazing job of reaching out to our residents who are in need. And it's not just for the rent and mortgage and utilities. There's many other things. You can see we have about 14% of our residents that contact us that are for other reasons. So far, since we started tracking at the end of August until the end of June, we've had over 1,000 resident contacts to date. And of those, you can see there's 870 agency referrals. This next piece about the court calendar, I'm going to talk about that again in a minute. And then, of course, distribution of our flyers. And that's something that I will also cover again in a minute because we're trying to ramp that up during during the current moratorium. So a lot of kudos goes to our CARES team for spending a great deal of time helping our residents in need. One of the things they do is they monitor the court calendars. So this is for the Santan and San Marcos Justice Courts. All of the evictions are ran through the Justice Court system. The San Marcos Court has 100% Chandler residents that are part of it, but the Santan Court has residents not only from Chandler, but Mesa, Gilbert, Queen Creek. So the total number of evictions that they have seen is over 1,800. But we drill that down to how many are from Chandler and then how many we can get contact information for. And that's where it gets tricky. The staff has to literally research and try to figure out the contact information for people who are on the court calendar. They've been successful at getting a hold of 316 households. And we're very proud to note that there have been 119 evictions that have been prevented through this program. Also equally proud to share that the city on a weekly basis, I meet with the other human services directors for the other cities and with Maricopa County. And the system that we have developed through the CARES team with monitoring the court calendars is going to be replicated in other cities because it's been such a positive outcome. In addition, recently Maricopa County contracted with Community Legal Services to have a representative at every one of the justice courts. So through that, we expect to be able to have more contact information or have the Community Legal Services representative be able to refer people over. The benefit of being able to capture the families at this point in the eviction is that we can work with Ascend to get them at the front of the list for the eviction prevention dollars. So it's been very helpful to especially when you consider these families are really they're at court and they're very concerned about being evicted. Excuse me. So this has been very beneficial to get those counties really kind of to the front, or excuse me, those families really to the front of the line at a critical point.
Mayor. Yeah, before moving on from that slide.
Mhm.
So again, you talk about again 316. I mean, overall, it seems like a pretty good success rate. However, is there a note, or can you provide a little bit more color on those that were not able to prevent it? Was it because they didn't qualify for it? Because there are a lot of, again, other reasons or restrictions on why people can be prevented to be evicted due to, again, COVID impacts. But if they were outside of that, then do we have that again? Is our success rate even higher because of these not successfully evicted? Is it because they just weren't eligible to not to be?
Yes, through the mayor, Councilmember Lopez, you're exactly right. If we don't have that specific data, but we do know, and actually the CARES team actually does, kind of incidentally know some of that data. But you're absolutely correct. There are other reasons that people get evicted that doesn't have anything to do with late rent. So if you were to be able to drill it down just to the rental piece, the success rate is even higher.
Okay, perfect. Thank you.
The takeaway that we want to give everyone tonight, of course, is where we're at. We still have plenty of dollars that are available. We have spent about 51% of our ERA 1 money. We need to spend 65% by the end of September. As I said before, we're going to be bringing forward the ERA 2 money to be allocated by council. We want to be able to do that. So as soon as we hit that 65% on the ERA 1, we actually will have to shift funds over due to other deadlines, but we will be bringing that back to you. So we want to let the public know there are still plenty of funds available to help. They can pay for past due rent, future payments, utilities, move-in fees, deposits. With the ERA 2 money, they've been able to expand a little bit some of the uses on that. There's a piece that can go for people who are experiencing homelessness as far as guaranteeing some future rent. So we just really want to get that word out. And again, I would encourage any resident in need in Chandler to go ahead and go through our CARES team, because they can take that look at your case and go through it and see if there's something that we can do to expedite it. One of the things that I know people have heard is that there's a backlog of applications, and I wanted to explain that a little bit. The CAP office has been wonderful at constantly looking at their processes, and recently they just made some process changes, and they've actually doubled the number of payments they've made over the last 2 weeks. And so they've kind of looked at what they're doing. All of the CAP offices in the area are struggling with staffing. They've all been competing for the same staffing pool and all having to ramp up with additional staff. One of the other positives that came out today is the county has contracted with Solari, and Solari is going to be taking the applications that people have not followed through on. So for example, right now there's 650 applications roughly at Ascend. Some of those have been there open since March, and it's a matter of the applicant not following up on whatever documentation that was needed. Ascend doesn't close those because they want to make sure that if that person does come back, they can very quickly respond to it. So what we're hoping to be able to do is also have a Solari assist with making calls to those open files and see if we can find out if it's the person is no longer in need, or if it's a matter of they just haven't followed through, and what can we do to urge them to follow through. And then the other thing we really want to do, like I said, is reach out to the public in this next 30 days or so. We know that there's a segment of our population that still isn't aware of these dollars, and we know that because we get calls every day. And we want to make sure that we're marketing to that segment of the population that we feel maybe either hesitant to look for the assistance or just unaware of it. So we're going to try to be creative in some of the ways that we go out and do outreach in the community, similar to what we did with the census, and trying to find some trusted voices and do some additional outreach that way. And with that, I would be happy to take any questions.
Questions? Councilmember Ellis.
Thank you so much. That was a wonderful presentation. The population that you just talked about is that little sliver who they are working, but at the same time, they can't meet the ends. And so they don't think that they need it until it comes up upon them. And you mentioned that you want to reach out to that population. What exactly are you doing? Are you going to do for to really reach them? I know it could be because they are also looking at shame. They're looking at feeling guilty that they can't provide for their own families or anything like that. How can we overcome those kinds of stigma to get to those people and let them know that the money is here? If you don't use it, it's just gonna sit here. So how are you doing that?
Through the mayor, Councilmember Ellis, one of the examples, we recently attended the Meet the Teacher Night at Galveston Elementary.
Mhm.
We actually signed up about 40 people that evening that needed assistance out of 200 that attended.
Wow.
So going to places like that are, again, trusted voice, the school is a
Mhm.
trusted location, being able to reach out. And we've also done that at another Title I school, so looking for some
Good,
additional opportunities
good.
to maybe go through the Title I schools when the parents might be there.
Mhm.
With the other thing is trying to get into the community. We are going to look at possibly seeing if we can set up a table at certain grocery stores and see if we
Mhm.
can do some outreach that way. And tapping into the nonprofits, reminding the nonprofits in our community, and of course our faith organizations, to please help spread the word that these dollars are available.
That's wonderful. I know that for our city is a great partner, and there's so many different voices at the table that are trusted, as you said. Another great partner that we can also incorporate in those is the churches that are already at the table also, not just the nonprofit, but the churches. That's where people usually go when they have problem. They go to their church or their pastors, and I know a lot of those churches, they have funds, but they can only go so far. And if we partner with them and let them know, send letters to them, specifically those that are really in partnership with us, send them letters and say, hey, when one of your members come to you and they need that kind of help, can you redirect them to us? I think that will really help us to open the doors to get that population in and be able to serve them. Thank you.
Thank you.
Additional questions? Councilmember Lopez, and then
So,
Councilmember Harris.
A little bit of a nuanced question. I trust you're going to probably know it. So you mentioned in the ERA1 funds that they had to be spent, 65% had to be spent within a certain time period. Is there a requirement for beyond that, for the remaining 35% that they must be spent with a certain time?
Yes, through the mayor, Councilmember Lopez. Originally, that was the end of December, but that has been extended, I believe, until September of 22. Is that the latest date? 20, I think so. Those dates kind of have been changing a little bit. So we're not as worried about that pressure of getting the final expenditures, especially if we've already reached that 65%, which is why we would switch over to ERA 2 to meet some of those deadlines first, and then it'll go back to ERA 1 again.
So that does go on to my next question, like multi-parter here, Mayor, if you don't mind. So for the two funds, is it the same 65% by a time period and then another extension for the remaining 35?
Through the mayor, Councilmember Lopez, I'm going to look to Brian. She's got the latest deadlines on that one. Is it?
Come on.
You want to come up?
Through the mayor, Councilmember Lopez, ERA 2 is 50% by March 31st of 2022.
And for the second remaining 35?
That's the, you mean the
I
ERA
mean
2?
the 50 remaining 50%, I'm sorry.
Then I believe it's 2025 as well. Yeah,
The 2025.
yeah, we'll have to check on
Okay.
that date. They keep, it's moved a couple times.
Okay. Yeah. So the one thing I did want to point out then is because there's a lot of questions that, through the public are coming back is because a lot of these funds are being kind of left on the table. People think, again, when 2.0 came out, there's a lot of concern that I think the number being thrown around was, 47 billion still sitting on the table that had been unused for rental assistance. And why are we going back and trying to, again, put more tax burden onto the taxpayers on putting more money towards this when there's still money left to be spent? So would it be fair to say is because in the intent for these funds, it goes beyond just this year, next year, goes to 2025, that we will always have, well, it's always, there is going to be extended amount of money on the table because, again, we're not going to be able to address that need immediately. There's going to be a need that will perpetuate beyond 2021, 2022, so that these funds, again, do need to be left in the budgets for a long period of time than just this fiscal year. That'd be a fair assessment then.
Yes, through the mayor, Councilmember Lopez, absolutely. And the other thing that people have to keep in mind is that the money came out and then the rules come out later. We have experienced this many times with these types of funds. And so there's a slow start to spending in the beginning too. And that's part of the reason why you're seeing the headlines that you're seeing. And now that there's kind of a groove underway and the guidelines are being refined, people are able to start spending quicker.
Okay, perfect. Thank you.
Councilmember Harris and Vice Mayor.
Thank you for that presentation. I really appreciate bringing this forth because a lot of constituents have had questions and concerns, and I think it's always great to have these clarification conversations. And Chandler, how long is it taking? I know we spoke about, we spoke previously about the fact that some of the other cities are taking a very long time to to get from start to finish. And I wanted you just to kind of share us a progress report on how fast, if I start this process, how fast is it? How fast was it taking before, and now how fast is it taking for us to go from start to finish with the proper documentation?
Yes. Through the mayor, Councilmember Harris, really the time before has kind of varied depending on, again, the number of staffing, looking at some processes. But currently, if a completed application is received, it's 15 business days from the completed application to the payment to the landlord.
Okay. And that payment to the landlord, is that generally done via the check, or is it done like ACH?
Through the mayor, Councilmember Harris, most of it, I believe they try to do through ACH, but I think sometimes there are checks there's in it too. If it's a landlord that's had multiple payments, they're going to have systems already set up for that landlord, the banking information, that kind of thing. If it's a new landlord, it might take a little bit longer to get that information set up.
And generally, once they're approved, they then get a documentation from you all stating that they've been approved to receive this fund, and then they tell us about that.
Yeah. So through the mayor, Councilmember Harris, yes, there is documentation from Ascend that they are approved before the check actually gets to the landlord. That's typical even prior to any of this program, whenever there was rent assistance, that as soon as it's a promise to pay, basically is what it's called. And that promise to pay can be used at the courts to stop an eviction. If it's now with the moratorium, it gets a little more complicated, but I won't go into the whole details of that, but basically it can stop the court process. And then, of course, it's that promise to the landlord.
Okay.
And then,
And
Right now, we're making phone calls to the landlords
okay.
as a guarantee, and then we will also drop off checks right now. If they need it someday, then we will drive it to them.
Okay.
we meaning Ascend.
Yes.
Okay. All right. Thank you for that
Yes.
clarification. Because I was about to say I'm gonna need some more gas. So I guess my last question is that so basically before the dates it varied from the time process, so it was taking 7 weeks or longer, and so now you're saying, hey, within if a person comes from start to finish with their paperwork, meaning the paperwork that they're getting from the landlord that a demand notice, what type of paperwork do they need to have basically, so that just explain to everyone what type of paperwork are they supposed to have, and it could be some variance because of the Ascend may have some additional paperwork that they may have, but for the most part, what's the general paperwork that a person needs if they're having this issue?
Through the mayor, Councilmember Harris, you're talking about the paperwork that the tenant needs to apply for the funding?
Yes.
Okay. So there's income documentation, tax returns, the W-9, and then there has to be a copy of the lease or something to substantiate the rent and the agreement between the landlord and the tenant. Am I missing anything? Oh, the proof of relation to COVID. Yes, that's the piece that's still there. The proof of the relationship to COVID, that this was caused by COVID.
And so that generally that proof of relationship is generally the letter from the employer, either saying, "Hey, we laid you off due to COVID. We had to cut back." That's the type of proof you're talking about. Something that outlines from a third party that this happened. Maybe it came from the doctor, and the doctor said, "Hey, you need to be laid off because of COVID. You're sick." Is that what we're talking about here? Something from a third party that's official that validates the decrease in income or the inefficient way of paying.
There are those types of documentation. There's also certain situations where self-attestation is allowed. That's something that has been dictated by ERA 1 guidelines, and now ERA 2 guidelines has kind of broadened those a little bit.
All right. With that being said, thank you again for your hard work, your team doing a great job and making sure that we stay on it. And we as a city we're a great city. I mean, just the fact that we're taking that going beyond, delivering the check to the landlord, talking to our residents, going to their homes, doing whatever we need to do to interact and make sure we can stop, including showing up to court. I think that's just going beyond the call of duty. And I think you're taking prevention to another level, which is a great thing. And our residents should feel comfortable. So again, I'm telling everyone out there that's watching this broadcast, please, if you need assistance, if you know someone, your mama, your daddy, your sister, your brother, your cousin, they live in Chandler, you need some assistance, we have a great team that can help you. And if they are in the process right now, we have a team that can speed up the process from start to finish even faster than 15 days. So with that being said, thanks. Thank you.
Thank you very much.
Additional questions or comments? All right, thank you.
Thanks.
All right, with that, next on our agenda is unscheduled public appearances. Do we have any?
Mayor Hartke, no, I've not received any cards.
Okay, with that, current events. I'll start. Got 3 current event announcements that I would like to make. First, again, a big shout out to our Chandler Olympians. They made us proud, and our Arizona Olympians. The Tokyo Olympics came to an end last weekend. I've watched them. My wife is a serious fan of the Olympics. And I want to congratulate all the Olympians that competed, especially those from Arizona. Arizona had 17 athletes that represented Team USA. That included Chandler's own Jamie Westbrook, who competed with Team USA Baseball and received the silver medal. Skateboarding made its Olympic debut with Chandler's Andrew Nicholas as the men's team manager. Way to go, Team Chandler. And now we will have the Olympic Paralympics competition. I know we have a Chandler resident who is competing in that, as well as I believe 5, if not more, Arizona residents as well, so we can continue the spirit of Go Team Chandler and Team Arizona as the Paralympics initiate. Secondly, I want to just give tribute to a person that if you were involved in the nonprofit circles, you know who I'm talking about. Michael Whitaker passed away last Friday. Michael Whitaker is a fine man, a veteran, a passionate volunteer who, as I said, passed away almost directly after talking to one of our city employees who he was helping set up an event. Michael was a leader in the Chandler Exchange Club. He was responsible for the one putting out the thousands of flags on 9/11 in Tempe and South and in Sun Lakes. Michael also spearheaded the Wreaths Across America program every December at Valley of the Sun. This year, the event will occur on December 18th, so a good time to join in and pay tribute to Michael. I've participated every year. And on Monday, August 30th at 3 p.m., which will be Michael's 70th birthday, there's going to be a celebration of life at the Valley of the Sun Cemetery. If you're ever in a room with Michael at the chamber events, he would always start off things with a big shout of "Hola." So he is gone, but Michael is not forgotten. And lastly, this Saturday, in conjunction with the Water Awareness and Drowning Awareness event, we are on August 14th from 6 to 10 p.m. at Desert Oasis Aquatic Center. There is a free dive-in movie featuring the movie Shark Tale. I thought we should have done Sharknado, but maybe not with the kids. So you're welcome to, it could be one of about 24 Sharknado movies right now. But you can enjoy the water safety booths and giveaway hosted by hashtag What Are You Doing prior to the start of the movie. So with that, Councilmember Harris.
Thank you, Mayor. Thank you. I also, too, am sharing some disappointing news. A longtime resident, Nancy Ritter, she was a member of the American Legion Post 35, and a dear friend of mine passed away at the end of last month. She was a huge contributor to the city of Chandler and will be missed dearly. And I think our last, we had text messages back and forth, and she's just a phenomenal person. It's sad to see our seniors leaving this place, but we know they're going to a better place. And so we are praying for the family, and we are praying for her children and all those around. So again, thank you. And then lastly, I'm just going to take a point of privilege. Just take this point of privilege. My birthday's on Monday, and I'm excited about it because I believe the wife have Sedona planned for me. So with that being said, I'm going to Sedona for the weekend. Thank you.
Well, Hopper, future birthday then. No formal announcements, just that now that kids are back in school, been driving out around there. Some of the schools, you can see that the lights are back on. Kids are running around on the playgrounds, but let's be careful as we're driving through our neighborhoods and even along some arterials that have schools along them. Let's be patient. Leave the house 5 minutes early if you need to, so we're not speeding through those school zones. And let's take care of our kids. Thank you.
Well, happy birthday. And while we're at it, happy birthday to my wife, who's got a big one coming up next weekend before our next meeting, but she'll be 30 again. I think she's watching, so I got to watch it. But happy birthday, baby. Bye.
Councilmember Rowe.
Thank you, Mayor. Not much from me other than it's a hot time of the year, even though it's been a little bit better than it has in past years. But do want to remind people to reach out to some of our nonprofit food banks and organizations that take care of our kids or help take care of our kids, whether that's Ascend or Matthews Crossing, the Salvation Army, Boys and Girls Clubs, or ICANN, and there's many others to choose from. They need your help, not just at Christmas, but all year long. So thank you.
Councilmember Ellis.
Thank you, Mayor. It seems like this is the season for us to bring news to our residents concerning those who are losing their loved ones. Christine Wegner and lost her brother. And then 2 weeks later, she lost her father, who was a firefighter and also a policeman, veteran out of Flagstaff. So on Saturday, we're doing a celebration of life for them. But at this time, I would like to also talk about the waiting list that we have regarding housing. We just spoke about it. There's money available, but we need landlords. We need people who will bring their house forward to help us get those people into homes. Uh, Up to the point where we have an incentive program where we would like to give landlords up to $1,000 to help out in those different areas. There's a program increasing rental opportunity in Chandler. So if you have a home or you know someone who have a home who would like to rent it to us with those with the vouchers, then it's time for us to really get involved and get those things to us. About 3,200 people are on our waiting list right now, waiting with vouchers, money in hand, but they can't find housing. So thank you so much for your help. Please bring those houses forward for us. Thank you.
Councilmember Orlando.
Nothing tonight, Mayor.
Yeah. Before I turn this over to Josh Wright, we want to revoke your Screen Actors Guild card since you are no longer acting city manager. And we want to congratulate you and thank you for continuing to be part of Team Chandler. And we rely upon your vision, your camaraderie, your leadership to lead the city. So tear up your SAG card. And do you have any comments, sir?
Yeah, well, thank you, Mayor, members of the council. Very humbled by your appointment of me this evening, and thank you for your support over the last 6 months as your acting city manager. It has been a privilege to get to work with each of you and help achieve your vision for this outstanding community. It's definitely a blessing for my family and for me to be here and part of this community, and certainly our outstanding staff here at Team Chandler. I did want to take a moment to thank our team. They're really the ones who do the work of this organization. You just heard some great presentations tonight about some of the exciting things that we've been able to accomplish with your support and with their outstanding work ethic. And so want to thank all of you and all of them for your support and look forward to the year ahead. Thank you.